Hello wonderful people, Dr. Sil here, and in this video we're talking about the top 5 mental illnesses in the world. Now, 1 in 2 people, 50%, 50 out of 100, whatever metric you want to use, half of everyone ever will have mental illness or disorder at some point in their life. That's a lot. Yet I bet when you're talking to people, you're not thinking that 1 in every 2 of them probably have had some form of mental illness or disorder. And that's because we're not talking enough about it. Because there's nothing wrong with having a mental illness, it isn't your fault, and it is better when we talk about it and destigmatize this stuff. So let's go through the 5 most common mental illnesses, but before we do, I just want to introduce myself. I'm Dr. Sil, I'm a junior doctor from Sydney in Australia. And in my free time, I really enjoy making YouTube videos about mental health and wellness and mental illness. So if you're someone who knows someone with mental illness, has a mental illness, or is working with people who have mental health issues, please consider subscribing, joining the community, and leaving a comment down below on any video topics that you'd be interested in watching, and I will do my best to make those videos. And together we can destigmatize and empower more people. Anyway, let's go. So number 1 is anxiety disorders. Now, you've probably heard of some of these. Things like generalized anxiety disorder, which is when you worry about lots of different things for more days than not over 6 months, and it's associated with cramping and awful feelings and worries, and it affects your sleep, and then it also functionally affects you, so it causes problems at work or with relationships and that kind of thing. There are also phobias, where there's actually a specific thing that triggers the anxious or panic response. There's panic disorder, which is another anxiety disorder, and that's associated with panic attacks and fear of having panic attacks. Panic attacks is that fight or flight response that, we all get from time to time, and it's an evolutionary thing where if there's a tiger chasing you, you don't want to be chill. You want to bloody sprint for your life. But if you get that inappropriately, just without triggers, then that's panic disorder. And other anxiety disorders include things like OCD, so that's obsessive compulsive disorder, where you get this mental obsession where you're fixated on something, and that's causing anxiety, so then you perform a behavior or a compulsion to relieve that anxiety, and that gives you a bit of relief, but then the cycle continues again where you have that obsession. So, I'm really worried that the light in the background is turned off, so I need to check. That's my behavior. I'm checking, okay, it's turned on, I'm relieved. But wait, is it turned on? Is it turned on? Maybe it's turned off. Maybe I just need to check one more time. And you just keep checking, and people will do checking. It will take hours and hours of their day. It'll affect their life and their jobs, and it's just a very debilitating thing. Obviously, there's a huge spectrum with all these diseases, but that is anxiety disorders. And of course, there are many other anxiety disorders that are beyond the scope of this video, but anxiety disorders, that's a very common mental illness group. What you can do about them, though, is psychotherapy and medication. So working with a psychologist to identify troubling thoughts and how to address them, and then also some pharmacotherapies like serotonin, so selective serotonin reuptake inhibitors, which boost serotonin levels. And serotonin is the neurotransmitter that generally gives you a sense of calm, cool collectedness. A little bit simplified, but it'll do. The next group of disorders are mood disorders, and these are very common. They include the depressive illnesses, which I've made videos about before. So that's things like major depressive disorder, dysthymia, also known as persistent depressive disorder, and also in mood disorders, bipolar affective disorders. So with the major depressive disorder, that's when you're getting depressive episodes, and depressive episodes are awful. And I wouldn't wish this upon my worst enemies. I don't have that many enemies, but if I did, I wouldn't wish this on them, because they can be really melancholic, where you're just so dysthymic. Everything is just awful, and living is really difficult in itself, and it's associated with a lot of suicidal ideation. It could also be anhedonic, where there's just a lack of feeling. Right? There's no joy, but there's no sadness, there's no motivation, you're just stuck. And when you don't have any motivation, it affects your concentration. Usually sleep is very poor. You stop doing things that you once used to do, that you used to find enjoyable. So you might have, maybe you used to like playing ping pong with your friends and you're a professional ping pong player. You wouldn't be doing that if you're having a depressive episode. So yeah, depressive illnesses are awful. And bipolar is essentially depression, but with episodes of mania peppered throughout. And mania is not as good as, a lot of media has portrayed it to be. People often think of mania as like really productive, really energetic, let's go, go, go. But often mania is, it's racing thoughts, sleeplessness, you're sleeping on 3 hours a day, not feeling tired. It lasts for 7 days at least, and you're doing so much and you're thinking so much that it's not, a lot of it's nonsensical and unproductive. It's also associated with like inhibition and things that you wouldn't normally do, usually sexual inhibition or spending ridiculous amounts of money, and that can really affect you. So there's a strong risk of you ruining your reputation if you have a manic episode. And often, they say that mania ends in two ways, either in hospital or in jail, or dead, actually. Yeah, it's something that often can get really out of hand. So that's also, bipolar is a pretty awful condition as well. So what can you do for mood disorders? Well, similar to anxiety disorders, it's pharmacotherapies such as those SSRIs. It's psychotherapy, so talking therapies with psychologists. Probably CBT is quite effective in depression, but there are other options. And keeping your physical health in good nick as well is super important. As a general rule, what's good for the heart is good for the brain. So eating well and exercising is great for mental health. The fourth group of the most common mental illnesses is psychotic disorders, so psychosis. This involves things like schizophrenia or brief psychotic episode or drug-induced psychosis. These can be pretty scary because the definition of psychosis is essentially when one's perception of reality is not intact, and the symptoms involve positive symptoms, negative symptoms, and cognitive symptoms. So those positive symptoms, they're things like hallucinations, which is when you see, feel, smell, taste things that aren't actually there. So most commonly though, it'll be hearing things that other people can't hear, auditory hallucinations, and sometimes they can be, maybe they're commentating on what you're doing in third person, but also they might just be saying awful things to the person. They also could be commanding, so telling them to do things. That could be quite dangerous, especially if they're telling them to do things like harming other people. So those kind of situations need to be controlled. Delusions are another positive symptom, and these are fixed and false beliefs that are inconsistent with one's kind of background. So delusions often could be paranoid delusions, so they might think that they're being followed by CIA agents, things like that. I was talking to someone the other day who thinks that the government is radiating them, and no amount of reality testing can change their mind. So when I'm talking about how, okay, if you're being irradiated for 20 years, by now you would have radiation burns, you would have cancers, and your blood tests are all normal. So how do you explain that? They can't explain it. They might say something like, look, I don't understand how it's working, but this is not a mental illness. This is real. I'm getting irradiated. And there's nothing really you can say to change that. Then the third set of symptoms, those cognitive symptoms of psychosis, are things like being thought disordered, where simply put, when you listen to them speak, you don't understand the flow of thought. It basically, their brain isn't following a logical sequence of thoughts, and you can't follow what they're saying. And there are terms we use like tangential or loosening of associations or circumferential, but all that, it's just thought disordered. Now, what can you do for psychosis? There's a lot you can do, and medications are pretty effective. You do need medications almost all the time. Psychotherapy, it's very hard to treat hallucinations with just like talking therapies, and there are effective medicines out there that can address those positive and negative symptoms that I've talked about. So obviously this needs psychiatrist input, not just like a junior doctor talking to you on YouTube or anything like that. And the best thing you can do is have a good relationship with a good psychiatrist, but also doing the other things like the social supports, going out, doing activities, exercise, staying healthy in all the other ways as well. Being holistic is really important. The fourth group of mental disorders are dementias, and these are neurodegenerative diseases. There's lots of them. You might have heard of Parkinson's disease. Most common one is Alzheimer's disease, and that seems to be associated with the aging process, because as people get older, the incidence increases, and I think it's something like almost half of the people who are 100 have some degree of Alzheimer's. And it's essentially neurons that are dying, and depending on where the neurons that are dying are is related to the symptoms you see. So often it's short-term memory loss, they forget where they leave keys, they get lost, they have problems with spatial navigation, and it can result in poor judgment, and often one of the early signs is forgetting words. So yeah, lots of different symptoms can evolve from that. What can you do about it? Talk to a geriatrician, talk to a psychiatrist, and talk to your local doctor. And you know, what's good for the heart is good for the mind. So if you're young, the best thing you can do to delay the onset of Alzheimer's is stay healthy, basically. The final group of disorders that are very common are eating disorders. And you know, thanks to society, media, and valuing what is often unattainable body images, many young people have unrealistic expectations, but that can also be associated with genetic predispositions, and you can get eating disorders. So things like anorexia and bulimia nervosa. So anorexia is when you have a really restrictive pattern of food intake where you just don't eat enough calories to sustain a functional human body. And you can imagine a car needs a certain amount of petrol for it to roll before it stops being able to turn on. And if you're just not eating enough calories, you can die. It's really dangerous. Anorexia is no joke. Often it can be comorbid with other mental illnesses, and it can be used as a form of self-harm or things like that, and it gets pretty complicated, but the therapy is essentially food. And that's a big problem, because the thing that is the most distressing to the person is the medicine you need to treat it, at least from the physical point of view. You obviously need a lot of psychologist and psychiatrist input to address the kind of cognitions associated with the food. But yeah, it needs to be addressed. Bulimia nervosa is also quite similar, where you can have binge eating and purging. But I think the takeaway point here is you need to talk to qualified professionals sooner rather than later. Okay guys, that's it for this video. Thanks for tuning in, I really appreciate it. If you'd like to support the channel, just leave the video a like, subscribe to the channel, and you can share it around as well. I'd really appreciate that. I wish you all an absolutely wonderful day. If there's anything you want to watch or see and want me to make, just leave a comment below. I'm interested in making courses, like educational courses, maybe like educational depression course. So if that's something you'd be interested in, let me know, and it'll help motivate me to get started on these things. But until the next video, I wish you all an absolutely lovely day. Goodbye.